Hi, I'm Dr. John Russell from Jefferson Health, and I'd like to talk to you for a few minutes about colorectal cancer screening. Colorectal cancer is the #2 cause of cancer death in the United States, the #3 cause of death in men, and the #3 cause of death in women from cancer. There is good news, though. We've seen a decrease in colorectal cancer deaths by over 40%, mostly due to the efforts of screening programs. So who should be screened for colorectal cancer? There are groups of people at high risk, such as those with a previous history of colorectal cancer or polyps, those with a family history of colorectal cancer or polyps, or patients with a history of inflammatory bowel disease, like Crohn's disease or ulcerative colitis. If you happen to fall into one of these higher risk groups, you should talk to your healthcare clinician about when you should begin screening and how frequently you should do so. But most people, those at standard risk, should start colorectal cancer screening at the age of 45 to 50. The United States Preventive Services Task Force says to begin screening at the age of 50, while the American Cancer Society recently lowered the age of screening to 45 years of age. And this was based on trends of ages of colorectal cancer occurring in younger age groups. Screening should end at 85 years of age, with patients and clinicians discussing what to do individually between the ages of 75 and 85. So let's discuss the most commonly used methods of screening. A colonoscopy is a test that occurs following a colon prep the day before. The colonoscopy prep has improved over the years. Now patients consume a smaller amount of liquid that's much more palatable. During the procedure, patient is given a light sedative and the colon is viewed through a fiber optic scope that is inserted into the rectum, up the left colon, across the transverse colon, down the right colon to the area of the appendix. If a polyp, which means growth, is seen, it will be removed in biopsy. Polyps can range from benign to precancerous, but a study has found that removing them has decreased cancer deaths over 50%. A normal colonoscopy would lead to a repeat colonoscopy every 10 years in standard risk patients. Other findings might shorten that interval. A FIT test, meaning fecal immunochemical test, is where a patient submits a single stool sample obtained in their own home for evaluation. A FIT test needs to be done every year. An abnormal FIT test or any other screening test that's abnormal would lead to a recommendation to have a colonoscopy performed. So you can see there are safe and acceptable options for screening. The only truly incorrect option is no screening at all. Talk with your Jefferson clinician about which screening test is best for you. Thanks for listening. I'm Dr. John Russell. My mission at Jefferson is to improve lives. Polyps can range from benign to precancerous, but a study has found that removing them has decreased cancer deaths over 50%. A normal colonoscopy would lead to a repeat colonoscopy every 10 years in standard risk patients. Other findings might shorten that interval.